back here getting ready to go. Ivy's in. That's not very fun. No. Sorry, sweetie.
Okay.
Hey everybody, welcome back to North and South. If you didn't know it, about a month ago I found out that I have breast cancer, and in just a few days, well, it's a week, but I have surgery, which will be the beginning of my treatment for my breast cancer. We've really just been in the testing phase up until now, but today, right now, I'm on my way to the radiation oncologist, because after I have my surgery and I heal from that, I will be doing radiation treatment. And that's because as long as the surgery goes well and they find that they get clear margins and I don't have it in a bunch of lymph nodes, then radiation will be enough to clean up any by chance breast cancer cells that are in there, because radiation hurts normal cells but not that bad. They can handle it. But my understanding is, at least, that the breast cancer cells are already weakened, and so the radiation kills them and leaves the rest of the cells alone. And so today will be my first time meeting with the radiation oncologist, and it will just be, I think, us chatting about the treatment plan. But after the surgery, I will also be doing endocrine therapy or hormone therapy to block the hormone receptors of my breast cells, so that if there are any breast cancer cells, they cannot feed off of the hormones, because I have the type of breast cancer where they do. Anyways, all that to say, it's been a quiet couple weeks since we met with the surgical oncologist, but I did get sick. I think I got COVID, and it made me really, really sick, which was a real bummer, because it made me like just feel like, no, I was supposed to have these like 2 weeks before my surgery where I was healthy and we'd like lived it up, because then I have to do treatment after that. So I was kind of bummed about that, but I'm better now, and we have 1 week, like I said. I'm still like, should I go somewhere? Should we do a little getaway? Should we take the kids up to the mountains? And I don't know the answer to that, but we're gonna go and see this. I'm glad Mike is coming with me. I don't know, during radiation, at first they say it's not, you won't even like be able to feel anything. And so at that point I might be driving myself, because it'll be like every day for like a month. But towards the end of it, and then afterwards, it makes you really, really tired. And so at that point you don't drive, I don't think. I don't know what that means, but I think that puts me real close to Thanksgiving. I don't know. Done. Yeah, right. We'll find out today. I'm glad to be finding out. I am glad to be finding out, because I found out a month ago that I had breast cancer. And so I've spent the last month wondering about, my treatment plan and timing and what my fall is going to look like. And so I'm glad to be finding a little bit more out today.
A few moments later.
So it was very nice. We chatted. They did a breast exam to kind of look. With how tiny these are. No problem. That is essentially what they said. But I'll talk to you more when we get to the car.
Yeah.
Okay. I mean, I had a lot of stress, like I said, lately. But it didn't answer tons of questions, did it?
There wasn't really anything new.
Yeah, because they're like, do you have any questions? I'm like, I've already asked ChatGPT all these. I don't say that. Because I said it one time to one nurse, and she's like, oh, don't do that. Google's full of bad information. I'm like, this
isn't Google, people.
But,
although it kind of is.
No, I mean, he just essentially confirmed everything that I already knew. One of the things that's stressful is I know that it seems like I should be happy, and I am happy with everything so far is lining up to seem like best case scenario for having invasive ductal carcinoma. But there's still a chance that it's a small chance. It's less than 10% chance. But, there's also less than 10% chance that you'll ever get breast cancer, and I got breast cancer. But next week, I will have the surgery. They will try to get clear margins. If they get the clear margins, that's great. They won't have to do another surgery. But then they will look at what's going on inside those cells and with the genes and all of that, and they'll give me a score. And if I get a nice and low score, then we're good to go, just have radiation. And there's a 90% chance I will. But there's a 10% chance that they'll say, actually, no, it's not that low of a score, so we want you to do chemo. And so, chemo is, if you need chemo, you get chemo. Like, it's not a death sentence, it's actually a life sentence. It's actually something you're doing so that you don't die.
Yeah.
And the reason they would do that is if like the cells that are in there seem to have some certain genes turned on that are making them replicate really quickly. And so it's going to be really hard for them to guarantee that they got all the cells out, and you don't want breast cancer cells moving throughout your body and setting up colonies. That's stage 4 breast cancer. That's metastasized cancer. We don't want that. That's still a little stressful. It will be quite relieving to find out. It will have the surgery, like I said, about a week. It'll take a couple weeks to get that information back. So you won't know on this video because we won't know either.
They do check a couple things though. They can know if they got the
clear margins.
And they do like a quick test. I can't remember what she told us. They like send it out
during the surgery.
I think to make sure they got the margins. They do something right there.
Yeah, she said it's not perfect, but like it does tell them.
Yeah.
Anyways, so we're gonna take it one day at a time. We're gonna trust that it's all gonna work out. Just being sick last week I was so sick that I was like, oh my gosh, chemo would make you so much sicker and for so much longer. So it kind of spooked me. But anyways, we are done for today, and we'll see you, I don't know, maybe when I'm having surgery in just a minute for you and in a week for me.
Okay, it's the morning of, folks. We're at the hospital.
For surgery.
In the car. It's pretty early.
6:30 a.m. And didn't sleep great, but that made it easy to get up.
Yeah.
So we're gonna head in, and first thing they're gonna do is use radiology will find these little markers they left in me, and they will put little wires to them that will stick out of me. And then they'll roll me to the surgery, and that will be how they can tell where to cut and stuff and go in and get the cancer.
Okay.
So let's go in.
Okay. When is surgery?
You have any kids?
I have lots of kids.
Under 19?
Yeah. I have 5 kids under 19.
Okay, that's good. Okay, awesome.
She's back here getting ready to go. Ivy's in. That's not very fun. No. Sorry, sweetie. Okay, well, I get to kind of sit with Megan between things, but not really during them, so.
I'm glad I get between, because I was like worried that
that was it.
Eat for hours.
Yeah.
Because my surgery's not for hours.
We still have a while, like 3 hours. I'm not really sure what's gonna happen other than the radiology
at
thing.
7:30, they're gonna go put those needles in, or those wires in, I mean.
Yeah.
And then that'll take us till 8, they said.
Yeah.
Then you'll come back and we'll hang out for 3 hours.
Oh, really? So,
When's surgery?
I don't remember, 10:30?
Or 11?
I'm not sure.
I'm not either, but yeah.
Okay, just waiting. Okay, Megan, so you're back here under this cool heated blanket thing, but they've got the clips in you now?
Well, no.
Oh.
Needles.
Needles, sorry. Needles.
Kind of like an IV coming out of the side of me, 3 of them.
A little painful.
Yes, it was painful.
I'm sorry.
That's okay. I just want to know where my hat is.
You want the hat?
Yeah, but
Says you should have a
my
hat.
My pants are not off, but oh well.
You're not quite ready yet.
Yeah, I guess so.
Okay. One step closer to this thing. 8:30. There's Megan's little cup they put on her.
They said they were going to put a cup on me, but I didn't really think it was going to be a cup, but
It really is a cup.
it's a cup with needles coming out.
Congratulations. Weird. Here's our space. Got a little curtain and the waiting area. How are you feeling?
Grateful that it's me. Somebody has their little boy here.
I think it's a little girl, actually.
Oh, really? I saw a little boy earlier,
Oh.
but either way, much easier to have this done to yourself
Yeah.
than to bring your own child. So, or someone else's child.
It's true. It'd be hard too. Are you getting nervous at all or anything
No,
like
I'm
that?
not nervous at all. Just tired
Okay.
and a little hungry, but
Stop and get some pizza on the way home.
I love you, bye. See you later.
It's gotta be modified, and then we're gonna get the race.
Okay, she's all done. We gotta get her out of here before we record too much.
No pain right now.
No pain, she's good. We're in the car, ready to go home. You did it.
You know what?
Got some parrot's booty.
Yeah, it was worth it just for that. If you're wondering,
For the complimentary parrot's booty.
I am blue. And
She's-
my pee is blue.
Because of some dye they use when they do the surgery.
They want to see where the first place your blood flow goes to the
Lymph nodes.
lymph nodes, so they take those.
Yep.
But now it's
Now everything's blue. Okay, we're gonna head home. Look at her. Look how nice she looks compared to yesterday.
Yep.
Because it's the next day now. How you feeling?
Great.
You feel good?
Yes. My pain level is very low, very, very low. Some of you had said that the worst part of the breast cancer treatment for you was the biopsy, the MRI biopsy. And I now believe you because I was in so much pain the day of the MRI biopsy. But thanks to this, I think,
That bracelet?
that's this, well, it's like some nerve thing they did to me. I have to wear this for 4 days because that's how long it lasts. I don't have a lot of feeling in this area. So I have like an incision here. I was worried it was going to be in my armpit. And I'm like, how am I going to heal from that? But I have one here and here. And it's tender. You know, I'm not like doing a lot of stuff. It's tender, but I don't feel that much pain, which is just like miraculous. Feel very grateful for that. My throat is sore because
The breathing apparatus
they
they
put
use.
something. That was actually my first memory, maybe, is them like that getting pulled out of my throat yesterday in my mouth. And then I heard voices and I thought my children were all around me, which was very sweet. And I felt real happy. And then I realized, wait, where am I? I think I'm in the operating room. The last memory I have was them lifting my body over to, you know, they gave me some medicine. They were like, oh, now you're going to feel really relaxed. But I actually felt already pretty relaxed. I had not slept much the night before. So I was just like, it was real easy for me to fall asleep already. And I think that was also a blessing to feel very relaxed because I had felt a lot of anxiety. You know, it was just like impending doom sort of thing that I didn't want to have, and I knew that intellectually wasn't helpful or maybe even necessary, but I couldn't seem to get it to go away. I just couldn't get it to stop.
Yeah.
You know, just like my whole body was filled with anxiety, which was instructive because sometimes when you're not the one going through something, you think, why are you like you think maybe somehow they're like doom spiraling or like making themselves that way. But I felt like it was a little bit out of my control, that I just felt really, really bad.
Right.
And I didn't want to feel bad. I wasn't trying to think negative thoughts. It was just like a huge weight. But going into surgery, I didn't feel that way. They gave me the drugs and they wheeled me down the hallway and into another room.
Yeah, I didn't get to show that because it's hard to record back there because, you know,
Yeah.
there's lots of people around. But yeah, they wheeled Megan off.
After they put my IV, in my IV, some relaxation drug. And then...
That's where I had to depart and go.
Yeah. And then I was glad Mike got to stay with me until then.
Yeah.
Because it was hours of waiting in a tiny room without, you know, you're just like sitting
With
there.
nothing.
I read the signs next to my bed like 35 times.
They were interesting signs, so it was good.
Then they must have put the sleeping drug in me because all of a sudden my eyes were closed, and I remember being lifted over to the operating table, and that was it. I still have the doctor's like little mark on me, I think.
The doctor
Right there.
puts their initial on you so that everyone knows that you're their patient, I think. That's why they do it.
Do you think that's why?
So
She
they
came
don't-
in and talked to us about the surgery, and she was like in her OR clothes.
Oh, are they?
Yes.
These are OR scrubs.
Oh, are they?
And then she's like, oh, and then she put her initials on me. I don't know why they do it, but
I'm going to put my initials on you, too.
yeah. And then the next thing I remember was the thing being taken out of my mouth and the doctor. I had a major surgery in my uterus in high school, and I woke up from that in so much pain. That was before this existed.
Well, also, it was very much deeper. It was like,
Yeah, but
you had to go
like-
through your stomach
And
muscle for that.
they went through they went up and down through my abdomen, and I
Gross.
woke up in so much pain, and I remember I'm like, oh, it hurts, and they were like, we can't give you any pain medication until you wake up all the way. But I woke up from this just like,
Nowadays, they give it to you right off the bat.
well,
They don't-
what is cool is it's like a slow release nerve
blocker
blocker.
sort of thing.
And so it lasts for days, and that's when
That's
your
why you're
pain.
feeling so good
I
today.
know that's when your pain is the highest. So what an amazing, miraculous discovery that is! I feel very grateful to live in such a great medical system with so many advances, because I remember how I felt in 1996. You know, and it wasn't good.
Should we give the timeline, though? So you went in, and then I had to go out to the waiting room, and it was a little over an hour.
Yeah, because it was like 10:40, I think.
Yeah. I didn't talk to the doctor till about noon. And what they do is you're sitting out there with everyone else, and then somebody comes over and is like, oh, go into this little room here so the doctor can talk to you. And you're like, is that a problem? Like, why do they have me go in some little
Come here,
room?
I want to talk to you for a minute.
So yeah, I went in there and I sat there for like 10 minutes waiting for the doctor, and you're like, is this going to be bad news or something?
Did you really start to worry?
You wonder, like, why did they,
Is
I
this
don't know.
normal procedure?
It just feels weird. Then she comes in, she was smiling though, and she was like, yeah, it went really well. So it was great. She just kind of gave me the rundown of how it went and what the kind of moving forward would be like.
She's probably trained herself to smile, because she can just like be in your thoughts and be like,
Yeah.
no, I need to be like,
She
hi.
had good bedside manner.
She does, yeah.
So yeah, and then I went back out and got the car, and then you were out. I guess we had to wait for you to kind of wake up a little bit more, but
I tried really hard to
Yeah.
wake up because I knew they wouldn't let me go
yeah.
until I was fully awake. But I had all this blue. It looked like somebody spilled blue dye all over my skin right here. But the wild thing is, it was inside.
It was insane.
Because it was gone today. This morning I hadn't showered or anything. So it was all just inside my skin. But it looked like, and it was bright blue. And yes, my face was kind of blue. I don't know if you noticed that yesterday, or green.
We might have mentioned it, I'm not sure.
Yeah, and then my pee, I know that's kind of gross, was like straight up like Mountain Berry Blast Gatorade. That blue one.
Is that an actual flavor?
I don't know, but
I
you know
want
that
it.
blue one? It was exactly that color. I actually made the kids come look. They're like, what? And they're like, whoa! So,
You always make them lick your urine, so I mean they're used to it. We went over what she said, right?
no.
Did
Did
we?
you? I don't know.
I don't know if we did
was
in the
like
car.
kind of drunk
I don't
out
remember.
in the car, so.
So she said there were no surprises. It was exactly
Yeah,
what
did she say anything about my
expected.
lymph nodes?
I
they
don't
look good?
think so. She just said she took a couple of them, but
So
nothing.
She just said a couple? Michael, this is important.
I don't remember. But she was like very positive, like this is exactly what we expected to do. It doesn't look like she said from what we can tell, it looks like we got clear margins. And she said at this point it's just checking out the microscopic level. So as far as what she could see, nothing looked out of the ordinary or beyond what she expected to see. And so she said we'll just wait a week
It's going to make me cry a little
and
bit.
then we'll get the results, and everything is pointing to looks like it hadn't spread, isn't fast growing, should just be able to move forward with radiation like we talked about. So
Yeah.
she was very, very positive and didn't seem concerned at all, really. you
Well,
know.
in my app this morning, it had the results that they did look at it under a microscope, and they what's it called? They X-rayed it, and they got all the clips because they
Oh,
want to
good.
make sure, because they're really small, so there's a chance you might not get them. You know.
Oh.
The worst part of yesterday was when they put these wires in that go like little fish hooks to the clips. They use like an ultrasound, and they're like digging around trying to get it in there, and it took them a little longer to do than I think is typical.
normal?
He had to redo it, you know, and then he redid it again. You know, he was getting a little nervous, and I'm just like trying not to make eye contact with the nurse because I don't want her to be like, or like
this guy doesn't know what he's doing.
Yeah. So we all just didn't make eye contact, you know, and he was like, sorry about that. But that, and the worst part was not just that was painful and uncomfortable. You know, you're like sweating and in a weird position so they can do it. But then you have to go in and get a mammogram with those needles and wires and stuff like that. So mammograms are bad enough, but doing it with that was not fun. You're just like, what the heck? But the nice nurse who was doing it, she said, I promise you this is the worst part of your day. Because in a minute when they go to take it out, you're just going to go to sleep and then wake up and it's going to be done. And she was right. But yes, I feel very low pain, 1 or 2. And then I just feel like a huge weight lifted. I didn't know if I would because the answers about the definitive answers won't be back for a week or 2.
She said a week.
She said a week.
She said
That's
1 week.
good.
Well, no week from today.
Yeah, and so I didn't know if I would still feel anxious, but I actually must have had a major anxiety about the surgery and about the pain that would come afterwards and like how long it would take for me to recover. But I feel really hopeful today because I'm a little woozy, a little tired, but not bad at all. I'm wearing like a corset, you know.
A binder, as they call
binder.
it. Keep everything kind of tight.
Which I'm happy to do to keep it all in so it doesn't move too much. I did look at my incisions. They look pretty gnarly, but hopefully with time they won't.
That's pretty minimal comparatively.
Yeah. So that's where I'm at today. I feel a little bit like George Bailey because I had so many friends and family praying for me.
There's people actually texting right now. Saying things.
Yeah, and I just felt so loved. Like George Bailey at the end of It's Wonderful Life, you know, the part where all of these people are coming in and giving him money. I'm waiting for the money. But
we haven't gotten that yet.
No, I really appreciate all the love and the prayers and the texts, and it's wild to think of people saying my name in prayer. You know, I feel very touched by that. And we should mention though, my niece and nephew have their own business selling tools, and they surprised us like 2 weeks ago by saying he did a raffle on his truck. He goes to all of these
auto mechanics,
and he told them that he was doing a raffle of this like pink rifle for breast cancer, and then they gave us the money, which was very sweet to think of all of these guys working in car shops donating money, and very sweet to think of strangers.
Oh, so nice.
You know, there are terrible things that happen in the world, and even this week terrible things have happened, but I have been this whole journey so touched by kind individuals being nice to me, caring about me. I just feel really blessed by that. And I hope I'm a better person because of it, and I have a desire to treat everybody with warmth because it makes a big difference for people when they're going through difficult things to just have warmth. Just any warmth actually is very, very helpful. So anyways, thank all of you, and we'll update you with what I hear and if my treatment plan really is just some radiation and then some hormone therapy. And
also real quick, we have new Knorpp and South shirts.
Yes.
We made the design. This design is the same, but it's actually new shirts because our company that does the printing of them had new shirt options. So
these are way nicer.
They're way softer. They fit really well. They have stuff on them.
This is nice. It's like, it's not just like.
It's got some texture to it.
Yeah, it's like 3D, embossed more like.
So if you want to get your Knorpp and South shirts, or for your loved one who loves Knorpp and South, you know, shirts.
What a thoughtful gift.
Yeah, we all got some shirts. We got like 15 shirts. So you should be seeing those more in the videos moving forward.
So anyways, guys, thank you so much for your love and prayers. Thank you so much for your wisdom. I did think of some of the tips that you guys gave me and the things you had said. So until next time, love you, and we'll see you then. Bye.
Bye.